And we'll be talking to the lead author of the World Malaria Report in the next hour, so stay with us for that. Meanwhile, in East Africa, Mutahi Kagwe, Kenya's Cabinet Secretary for Health, has said that the government will not force anyone to get vaccinated and that vaccinations are not mandatory. This is in stark contrast to a Kenyan government directive that Kenyans must show proof of COVID-19 vaccination by December the 21st to access services. For more on this, we're now joined by Irungu Houghton, the Executive Director for Amnesty International in Kenya. Thanks very much indeed for joining us. Good to talk to you again. When we last spoke, the law had just been introduced. Government was about to force people to do these vaccinations. What is the situation now? It doesn't seem quite clear. You have one government minister saying this. Has the December 21 officially been retracted, or is there still up in the air, not sure what the story is?
Good evening, Peter, and good evening, viewers. And just to praise SABC for catching up on the story, it's about the midpoint between when the announcement came out on November the 23rd and 2 weeks on. We've got 2 weeks before the end of the deadline, so it's a great time to review this. Yes, the Cabinet Secretary for Health yesterday announced, as he received 4.3 million JJ vaccines at the airport, that the government would not compulsorily force citizens to be vaccinated, and therefore this is the step back from the statement that was there on November the 23rd. So it is clear that it will not, people who have not vaccinated will not be criminalized. What I think we have to look a bit more closely at is the extent to which those people who have not fully vaccinated by the 21st of December, whether they will be able to access essential services, including services like the like health and education and immigration services. So I think that's the key element. He spoke yesterday about essentially his conversations with the transport industry, and definitely it looks like from the 21st of December, people will not be able to fly in and out of the country without a a full vaccination certificate. And in the case of Kenya, many people are using or are being vaccinated using AstraZeneca. So they will need two jabs in order to be able to travel in and out of the country. But it remains to be seen whether the transport industry and the entertainment industry locally will enforce these guidelines, or whether they will ignore them in order to just not cut themselves away from possible business that would come.
All right, let's just get some clarity here, because it's one thing to say that you're not going to be forced to be vaccinated, but it's quite another to then say you can't come into this building if you're not vaccinated. Have they been clear about access to government buildings, health centres, and even public transport? Have they categorically said that you can access health centres even if you haven't been vaccinated?
The minister was silent on this yesterday, and it should be mentioned that when the announcement was made on November the 23rd, there was tremendous public uproar. We issued a very strong statement that was picked up by several other organizations, and yesterday morning, just hours before the minister received the vaccines from the German Republic, there was a legal suit in court, lodged in court, that sought to file an injunction against the government from withdrawing services to citizens if they're not vaccinated. So I think it's still not clear what this will look like, but I think it is positive news in the sense that the initial statement did give the impression that people would be criminalized for not being vaccinated, that they would find themselves on the wrong side of the law for refusing to vaccinate, or just having not been able to vaccinate. I think the other thing we have to be very clear about is it's not necessarily the case that it is actually very easy for you to get vaccinated if you're outside of the major cities. For people in the northern and coastal parts of Kenya, vaccination is still it's still quite difficult for people. So I think that's going to be really the challenge as we move forward. But the good news is that it seems that the vaccines are still coming into the country. We got 4.3 million, and those are J&J doses, so those are single doses. And as the minister said, that is potentially 4.3 million people who could be vaccinated purely on that one plane load. But we have others coming in from the United States, another 1.2 million, and 400,000 coming from Argentina in the form of AstraZeneca vaccines.
If I remember our last conversation, one of the challenges that government has with this enforcement order is the impossibility of performance, because even though these vaccines have arrived, it takes a number of weeks before they're efficacious, and you literally can't vaccinate that number of people in that shorter period of time.
Yeah, I mean, the challenge, and it is a real challenge, and I think we have to see the challenge in the context of, the importance of universal vaccination. And we know, particularly with the new variant, that we have to accelerate vaccination all over the world. In fact, if anything, this variant is a consequence of the global vaccine apartheid that we've seen, which has left several countries, in fact, the bulk of the world, without enough vaccines, and a small proportion of the world with, large stocks that they're not able to utilize. But the figures yesterday, or the statistics yesterday, was that something like about only 11% of adults are fully vaccinated in the country, and 7.6 million vaccines is the number that we've managed to reach at this point. But we're still a few weeks away from the end of the year, at which there was a deadline for 10 million. But even 10 million in a population of 48 million is still very low. So I think we have to see an acceleration in terms of uptake and in terms of distribution for this to really be real. I think for the I guess private and public offices, it's not really clear whether they will heed the request, and I think it is now just a request from the government, essentially to ensure that vaccination certificates are looked at when people board private or public transport within the country, or whether they go into restaurants or public spaces.
Yeah, I mean, the admin in making sure that these certificates are legitimate might be another whole chapter, isn't it?
Yeah, I mean, we've already had a spike. I think it was reported almost 1 week after the announcement on 23rd of November that it is possible to buy a vaccination certificate for I think it was something like $10, and that people had begun to do this, or that Johnson & Johnson, which in many cases is the preferred vaccine because it's a single shot, that people were actually paying for the vaccines to be delivered to them and administered to them, which is completely absurd, given that one very powerful part of the Kenyan vaccination story is that we've managed to essentially provide this, like many other parts of the world, for free. But people would rather pay $10 to get a vaccine than necessarily be vaccinated, which is just a consequence of not enough public awareness and responsible citizenship.
Yeah. I'm not sure what it's like in Kenya, but here in South Africa, around about the 15th of December, the country starts literally to shut down, and people start traveling all over the country to their homelands. And I just wonder if it's the same in Kenya, because that will present itself also further problems for government, I'm imagining.
Yes, no, absolutely. I mean, in this sense, I think South Africa and Kenyans are probably very close cousins, in the sense that from the 17th onwards, in fact, even actually from the 12th, when we have a public holiday, it's Independence Day, we begin to shut down. And not only do people begin to go up country, but really the next wave of transportation will be people coming back in January, and many children being escorted to schools. And this is why, in many ways, this is going to be a very difficult request or guideline to enforce, because it will essentially have to rely on the self-regulation of the transport industry to be able to make this happen. I mean, I guess, vaccine mandates have been tremendously popular and controversial globally. I think in the United States, you have a number of states that are, implementing very effectively vaccine mandates. And then you have states like Arizona and Alabama, where the governors themselves have actually passed legislation, directive, or other executive orders that prevent businesses or industries from being penalized from admitting people who are not vaccinated. So I think, we'll wait, I think in many ways we'll wait to see what this looks like in a few weeks from now. But I think in a population where you have something like about 15 million people in the informal sector and less than 3 million in the formal sector, this is a very difficult policy to enforce. And that's why I think it's really important. As Amnesty, we keep saying that, rally us, don't bully us, rally us. Tell us why it's important to vaccinate, dispute the various myths that are out there about the vaccination. And one of them that is in Kenya is really the one around impotency and virility. And that's what we need to do at this point, is really educate people that there is no evidence that either you will grow horns or you will die within 2 years. That one is difficult to prove because we've not had vaccines for a while, but there is no indication, medical indication, that this will be likely. And then lastly, there's no indication that you will not be able to get pregnant or impregnate somebody else if you are vaccinated.
So Omicron has arrived. What is happening now in terms of infection rates? Because everything that we're talking about, again, gets multiplied by a certain factor. I know that 75 new cases reported yesterday. Is it starting to tick up?
No, not really. I mean, we're still at 1.6% infection rates, which is thankfully very low, and no known case yet of Omicron, which is good to hear. And I guess, just as a Kenyan talking to South Africans, just to say, that we have worried also for South Africa. We have condemned the travel bans that are selectively being placed, and rather than travel bans, what we would like to see is just an expansion of vaccines into parts of the world that just don't have enough at this stage. It's completely hypocritical to push up travel bans without an accelerated Marshall Plan like initiative to get vaccines into those parts of the world that need them most. I think that's one of the things that we've been really concerned about.
All right, perhaps as a final question, I guess you're pressing government and people need to know, to get some clarity about these requirements and the law. What is going to happen on December the 21st?
No, we will continue to press this issue to some clarity. We are thankful that the statement no longer is as rigid as it was on November the 23rd. We argued very possibly in different fora to make this happen, make this be lifted, and we're grateful that that's the case. But we still need to find out what is the implication in terms of essential services. And of course, as you've mentioned, 21st is very close to the Christmas period. It is likely that most services, with the exception of emergency services, will actually close down over the Christmas period anyway. But it's still not clear for how long. For example, if there is going to be a no vaccination, no service policy, for how long does that continue? Is it for the next year? Is it for 2 weeks in January? Is it for 3 months? It's just not clear enough for people to understand what's going to happen.
Irungu, thank you very much indeed. Always good talking to you. Thanks for the update.
Thank you, Peter. Good night.
Good night. All right, that's Irungu Houghton, who's the Executive Director of Amnesty International in Kenya, trying to get some clarity about this rules that the government of Kenya is trying to enforce on the 21st of December, that you can't use public transport or use government facilities if you don't have a vaccine certificate. But it looks like that probably is not going to happen, just because it's enormously difficult to enforce.